A very good day to Doctor and my fellow friends. We are from Group 8. Today we are going to present our slide with the title Impact of COVID-19 on the Institutional Industry of Malaysia. These are the members in the group who are Afiq bin Abdul Rahman, 211610, me, Lawrence Lim Kaisen, 213451, Tay Yi Ching, 212574, Nurul Nashwa binti Mustafa, 211254, and Asma Amira binti Azmi, 212059. Let us first go to the introduction. In early 2020, our country was shocked by the outbreak of the COVID-19 epidemic. This situation makes the people panic even more when the government announced a nationwide movement control order, which we call MCO, which came into force on 18 March 2020. Most food industry were ordered to close during MCO, either in the commercial or non-commercial sectors. The institutional industry is one of those affected. It affects the operation in institutional departments such as schools, universities, colleges, and also hospitals. The pandemic continues to this day, and action needs to be taken to prevent the spread of COVID-19 in this institutional industry. Next, let us see the effect of COVID-19 on institutional industry of Malaysia in colleges. We are focusing more to cafeteria and students. These are the impacts that cafeteria will face. First of all, the demand on delivery increases while demand on pickup service decreases. Second, cuts down the output of firing some workers and forced to change to a healthier meal, shortage in cleaning reagent, shortage in human resources, and shortage in food supplies. And that's all my parts, and I'll pass to my next presenter. Thank you.
Thank you, Lawrence. My name is Tay Ching. My metric number is 212574, and now I'll present about the impact of student that caused by the pandemic of COVID-19. The first impact of student is the inadequate physical activities and infection to physical health. Due to the spread of COVID-19, government established the announcement of MCO, which is the Movement Control Order, and the learning institution, including the college, need to be closed. Students have to undergo e-learning, so the physical activities such as co-curriculum will be postponed or delayed. And they have less chances to carry out the physical activities because they have to attend the classes and lecture by using the electrical device. Hence, most of the students are suffering with physical health problems such as obesity, damage of eyes and backbones, as they have to remain in sedentary behavior for a long period in front of the electrical device. And the next impact of students will be dealing with the problem of mental illness. This is because the e-learning requires the student in the college to face with the electrical devices for a long time, and this will lead to the problem of anxiety, depression, and emotional distress. Some of the students are suffering from difficulties in sleeping and eating, and this is because some of them are lacking of rest, and the mental health of them is getting worse throughout the period of COVID-19. Besides that, insufficient balanced diet is also one of the impact of students in the outbreak of COVID-19. Based on the study, the consumption of food by the college student decreases compared to the time before the outbreak of COVID-19. Hence, this has increased the health risk of the students since they are having less physical activity also. Lastly, the impact of students in COVID-19 is academic disruption. This is because most of the college students are suffering with the problem of financial and COVID-19 had already caused their parents to lose their job and income. They cannot afford to pay the fees for the colleges, and some of them choose to quit for the academic to reduce the burden of their family. And I think that's all from me. Thank you.
Assalamualaikum. My name is Nur Najwa binti Mustafa. My matrix number is 211254. Okay, now I will talk about the impact of COVID-19 on the institutional industry, which is hospital. In response to the coronavirus COVID-19 threat, Malaysia imposed several phases of the Movement Control Order (MCO) nationwide beginning on March 18, 2020. MOH has established COVID-19 care guidelines that are revised regularly and consistent with recommendations from international organizations such as the World Health Organization and scientific studies and treatment effectiveness for patients in Malaysia. Okay. Firstly, the impact is many hospitals have scaled back or postponed non-emergency care. This occurrence has affected hospitals financially in terms of food service and the price of the food due to the increasing number of COVID-19 patients. The health and social systems are also struggling to cope, and health facilities in many places are closing or limiting service. Next, the impact COVID-19 to the hospital workers caused nurses and other healthcare workers to have even longer shifts and work more days. Nurses have gained more exhaustion due to working longer hours. Due to the increasing number of patients, more nurses are required to serve the patients. Okay. Lastly, the impact of COVID-19 to patients is many patients with acute medical illness, whether life-threatening or not, did not seek hospital care out of fear of contagion or concerns about access at COVID-19 overrun hospitals. Patients' decisions to return to the hospital in the short and long term may also be influenced by patients' age, race, ethnicity, insurance status, and income. Factors of, often related to trust in or access to the healthcare system. Groups or groups of patients that are continued risk for under treatment of acute medical illness. That's all from me. Thank you.
Hi, my name is Asma Amira binti Azmi and my metric number is 212059. So I'm going to present about challenges to college in the service during COVID-19 pandemic. As we know now, we are living in challenging times. The advent of COVID-19 has forced college cafeterias to make change to the way they operate. So the first challenge is adapting to new safety protocols. The situation before this pandemic is very different from now. Before this, the college cafeteria have always followed strict health guidelines, but now they have to redouble their effort for the good of customers and their staff. The cafeterias need to prioritize health and safety. They have to adopt preventative actions to slow the spread of the virus in the college. For example, the government has enforced social distancing, so the college cafeterias have to follow the guideline. They need to make sure their staff wear face masks, face shield, and gloves. They also need to make sure their customers to line up 1 meter from each other to avoid large gathering, and they have to change their layout to accommodate social distance. Next, the challenge in keeping staff safe for both mental and physical health. Taking care of staff means more than just keeping the workplace clean. This puts everyone on their staff in a vulnerable and stressful position. Because of this pandemic, some of the staff may be anxious or afraid to work as they come into direct contact with customers. So the cafeteria have to schedule strategically to ensure that their staff are protected from illness. For example, if one of the staff is sick, they can distribute shift, and if they don't already offer paid sick leave, this is the time for them to offer and consider adopting a more lenient stance for the near term. During this pandemic, sensitivity and understanding are emphasized to ensure that their staff stay healthy. And the last one is challenge in the use of technology. Technology plays a big role during this pandemic. One of the example is the cafeteria needs to set up a MySejahtera QR code for customer and staff. Of course, everyone is already familiar with the government's contact tracing app. Now, anyone wishing to enter any premises need to scan the QR code. Compared to the situation before this pandemic, we don't need to scan any QR code when we enter any premises. Moreover, to moderate the direct contact, the cafeteria have to encourage online payment, such as pay by Boost e-wallet and Touch and Go e-wallet. This way may be a new thing for some cafeterias that typically only use cash payment. I think that's all from me. I will pass to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Afif bin Abdul Rahman, and for my part of presentation, I'll be presenting on challenges in services during COVID-19 based on hospital. Okay. Challenge faced by the hospital in food service is food distribution and meal orders were the two aspects most impacted by the COVID-19. Food services staff were not allowed into wards with COVID-19 patients to hand out meals. So nursing staff working in these wards had to do this job. Hospitals that had been using tablets to take meal orders from patients were forced to change the paper menus that can be discarded after use to minimize the risk of spreading of virus of COVID-19. The hospital also created a meal ordering application for patients based on phones to take their meal orders without any face-to-face interactions. All the participating hospitals were concerned about the safety of the kitchen staff during the dishwashing process, as there could be chances of catching virus from contaminated the crockery and the cutlery. As such, some hospitals replaced the real crockery and the cutlery with disposable cutlery and crockery. However, it created another problem, which is plastic waste. And another difficulty was managing the stress and fear towards COVID-19 among the team. The constant change and uncertainty about the virus triggered the anxiety and was even more challenging for the managers, as they had to keep the staff calm while busy maintaining the normal operation.
And now I will continue my part by talking about the ways to overcome the challenges and SOP during COVID-19 in the college. The first will be social distancing. According to the SOP that announced by the government, students who dine in and queue up in the dining hall or cafeteria should maintain social distance from each other, which is at least 1 meter, and prevent direct contact from the people. And the second way to overcome the challenges are online ordering for food and takeaway services. Students are able to online order the food by using smartphone and electrical device, and now the takeaway services are available in the canteen or cafeteria of the colleges, so they do not have to stay outside for a long period to having their meal and decrease the spreading of COVID-19 among the colleges. And next, we'll be reducing the number of tables in the dining hall, and this is also to prevent the crowd of people to dine in, and also encourage the students to take away their meal and also having it in their own room also, and to prevent the crowd of people in the cafeteria or also the dining hall. Besides that, only open one entrance for the student to enter the dining hall or canteen, and requiring mask and temperature checking before entering the dining hall is also the ways to overcome the challenges during COVID-19 of the college. Maintaining one entrance is easier for the staff of the cafeteria or dining hall to make sure the discipline of the student and prevent a crowded, and also it is easier for the staff to make sure the students are according to the SOP that announced by the government also. However, wearing mask and temperature check is the must before the student to entering the dining hall. If the student refuses to do so, they will not able to entering the dining hall, and maintaining solid sanitation practices such as hand washing, cleaning and sanitizing will be the last way to overcome the challenges. The staff of the cafeteria and canteen are in charge in this field because they have to make sure the area of the school is clean and prevent cross-contamination between the student, and also stop the spreading of COVID-19 among the student in the colleges. And that's all from me. Thank you.
All the negative things that COVID-19 brought to the hospital food service, there are still some silver linings. There are ways to cope with these challenges, such as physical distancing must be practiced by the workers that handle food in the hospital. Physical distancing is extremely important to help slow down the spread of COVID-19. This is achieved by minimizing contact between potentially infected individuals and healthy individuals. WHO guidelines should maintain at least 1 meter between your fellow workers. Besides, provide personal protective equipment such as face masks, kitchen coat hat, apron, disposable gloves, cleaning overalls, and work shoes to reduce slipping for employees. When employees wear PPE, the distance between workers can be reduced. Therefore, this physical distancing is important to ensure the workers do not have any close contact and to prevent the spread of COVID-19. All right, for the result part, okay, as a result, hospital food services present a challenging system compromising a myriad of factors ranging from administrative functions to highly complex medical decisions during the pandemic COVID-19. To be honest, COVID-19 is still alarming, and countries have all invested a great deal of manpower and material resources. To better deal with the continuous pandemic, hospitals in other countries could take precautionary measures like wear masks, physical distancing, and practice a good hygienic practice in order to reduce the virus transmission, in order to help the society among ourselves. So they could take these active steps to promise a well-balanced nourishment for medical staff and patients. All right, that is all from me for my part. Thank you.
In conclusion, the emergence of COVID-19 epidemic has clearly had a major impact to the institutional industry, especially hospitals and colleges. Based on our study, we can say that the most affected individuals are frontline healthcare workers who are classified as high risk because they provide care to the COVID-19 patient. In addition, for the college, students are under pressure due to this pandemic, and the cafeteria face impact in the lack of food supplies, cleaning reagents, and human resource. As we know, this new norm is very much concerned with hygiene. Hence, everyone must do their part to protect themselves by practicing social distancing, frequent hand washing, and sanitization to reduce the number of rising COVID-19 cases. Even though the COVID-19 is changing our lifestyle now, we have to adapt because we don't know when this epidemic will end. That's all from our group. Thank you.